Are stomach pains getting in the way of your life? Or maybe you had too many tacos on Taco Tuesday. I know, I've been guilty of this as well. Well, sometimes there could be a simple answer of why you're having your stomach pain, but other times it could be a sign of something bad going inside your gut. In today's video, I'm gonna give you 5 of the most common causes of why you're having stomach pain, and I'll go over 7 natural options to get your stomach pain controlled and calm down. And at the very end of the video, I'll give you my tips on when you need to see a doctor to get that stomach pain checked out. Guys, let's talk about food. Howdy y'all, Dr. Islam here, aka your poop guru. I'm trying to give you, yes you, the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter where you can get great tips and tricks like you're learning in today's video. Now, abdominal pain is such a common problem that a lot of people suffer from. A lot of people have the occasional aches, pains, groans, ooh, but sometimes that pain could be a sign of something going on inside your gut. You may want to know why. Here are the 5 most common reasons why you're having stomach pain. Number 1, a condition called IBS, or irritable bowel syndrome. It is exactly what it sounds. Your bowel, it is irritated. It is irritable. It is bowelable. I have no idea, but IBS is a real condition. So what IBS is, it's abdominal pain associated with a change in bowel habits and bowel caliber. And there are a couple different subcategories of IBS, whether it's IBS diarrhea or IBS-D, IBS constipation or IBS-C, IBS-M, which is a mixed component of both diarrhea and constipation, or IBS-U, unclassified. But the predominant symptom of IBS is abdominal pain, but typically that pain will get better once you have a bowel movement. Treatment can include dietary changes, probiotics, prebiotics, medical therapy, stress management. There are a lot of options you can do, and I have a lot of videos on this as well. Number 2, constipation alone can also cause pain. Yes, if you are stopped up, if you are full of poo, if things are not going through, all that pressure can cause your belly to feel bloated, not feeling good, having pain. You have poor appetite. You just don't feel very, very good. In fact, I have a lot of patients who have constipation that have all sorts of gut issues going on, including abdominal pain. But once you get them going and flowing, that pain goes away. Some treatment options for this, including using fiber, drinking water, adding some magnesium to your diet, and a lot of other medical therapies. Number 3, ulcers. Yes, stomach ulcers can significantly cause pain. An ulcer is an irritation in the lining of the stomach from a lot of different reasons. The 2 most common reasons being an infection called H. pylori, or medications like Aleve, naproxen, Advil, Motrin. And this pain can be a really bad pain in your stomach that sometimes can get worse or sometimes even better after eating. Now, there are a lot of treatments for ulcers, but it depends on the cause. So for example, if it's due to stress, you gotta minimize stress. If it's due to the infection, get rid of the infection. If you take an anti-inflammatory medication, you wanna stop taking that. But the mainstay of treatment is to put you on an acid medication to help control the acid to minimize the effect of that acid on that ulcer. Number 4, sometimes your pancreas can be inflamed. It can be due to a condition called pancreatitis. What this is that your pancreas is right here in the middle. And when it gets inflamed, either from a gallstone, maybe alcohol, you can have severe pain that goes right here straight to your back. That is the classic pain that you have with pancreatitis. It's pain in the epigastric area going straight to your back. The only way to diagnose this is with either imaging and or blood testing. And sometimes we have to treat the root cause of why you're having pancreatitis to get rid of that. So we give you IV fluids, we give you pain control, and if you have gallstones, we remove that gallbladder, or if you're drinking alcohol, we make sure that you don't drink any more alcohol. Number 5, diverticulitis. You may have heard of this. This is inflammation of the pockets in your colon. Now this commonly presents with left lower quadrant pain with some fevers, chills, maybe even some rectal bleeding as well. Now the only way to diagnose this is with a CAT scan, meaning I can't diagnose this just by doing an exam on you. We actually need imaging to confirm you have inflammation of those pockets. And the mainstay of treatment when it comes to diverticulitis is the control the infection. Give you antibiotics, maybe some bowel rest, but you have to give you antibiotics to get the inflammation down, get that resolved. Now, there are natural things that you can do to help out with this, making your stool softer, not being constipated, eliminating red meat, and having a lot of fruits and vegetables to increase the amount of fiber in your diet. Now, these are the 5 most common causes of why you have abdominal pain. It's very important if you have pain to not make a diagnosis based on this video. No. You need to speak to your healthcare provider, get certain testing done, find out what's going on, because they are the experts in getting trained to find out why you're having the pain. They may recommend some blood testing, some imaging, and maybe even some scopes to see exactly what is going on. So maybe you're wondering, all right, Dr. Islam, I know I have pain. There's weeks until I see a doctor. What can I do today to help relieve the pain? Here are my 7 recommendations. Number 1, try to increase your fiber intake. We know that foods that are high in fiber are great for your gut, no matter the cause of the pain that you're having. It decreases inflammation. It improves your gut microbiome. It gets things going and flowing and gets you feeling better. It is the foundation for gut health. Number 2, try to eliminate or avoid red meat. We know red meats like beef and pork can increase inflammation inside your gut. It can increase the bad guys, make the good guys suppress, and really change your gut microbiome and make things a lot harder to heal in the long term. So try to minimize or eliminate red meat. Number 3, drink plenty of fluids. You'd be surprised how much of a mainstay in a treatment this is of just having fluids, whether it's drinking water or getting IV fluids. It works miracles and really helps out when it comes to abdominal pain. Number 4, consider adding peppermint or even chamomile to your diet. Peppermint has been shown to help relax the gut, to soothe the gut, to help out when it comes to pain. It's a very effective option that I recommend to a lot of my patients, whether it's peppermint tea, peppermint gum, or even specialized peppermint release in the GI tract. Number 5, exercise regularly. Staying active, making sure you have exercise to increase just your heart rate and get you feeling better is an effective natural way to help out when it comes to abdominal pain. If you're able to exercise, get up and get moving. Number 6, try to reduce your stress level. I know it's easier said than done, but stress plays a significant role when it comes to gut health. The more stressed that you are, the more cortisol hormones are being released, the more it can impact what's going on inside your gut. It can make ulcers worse, it can make diverticulitis worse, it can make abdominal pain a lot more worse than if you're not as stressed. And number 7, try to minimize or eliminate processed foods. We do know that processed foods are not good for your gut. It's not good for your gut microbiome, and it is certainly not good if you have abdominal pain. A lot of the way that foods are made in processed foods, the greases, the ingredients, the preservatives, they just set yourself up to have a lot of gut issues. So try to eliminate or get rid of processed foods. Now, these are natural ways that we recommend to help out when it comes to gut issues, but I want you to be aware there are certain things you should not ignore and make sure you see your doctor about. Number 1, if this pain is so severe that it becomes debilitating, make sure you speak to your doctor about this. Don't wait on that. Number 2, if you have associated black stools or bloody stools, that is something to never ignore. That could mean that an ulcer is causing bleeding, or you could be bleeding from below. We need to find out exactly what's going on and make sure that does not get ignored. Number 3, if you have significant weight loss is never normal when it comes to abdominal pain. Make sure you get that checked out. And these are the common tips and recommendations that I recommend to my patients when it comes to abdominal pain. Keep in mind, every single person is different, so make sure you speak to your healthcare provider first before you do anything. Find out what's going on and make sure you actually have a diagnosis. Guys, I thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter. We're getting great tips and tricks like you're learning in today's video. Guys, I thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.